Okay, good morning, and thank you very much for an opportunity to me to share an experience in congenital heart disease for my country. In my country, there has some limitations of medical service and pediatricians and the pediatric cardiologists. Okay. Congenital heart disease is a common anomaly with an approximate prevalence of 8 to 1,000 live births. Among the congenital malformations, congenital heart disease is the most severe form and cause of high mortalities. Although minor lesions do not impact on the mortality risk, but an increasing risk of infective endocarditis is always an important aspect. So, early detection could not only provide the optimal therapy, but can also prevent complications. In the rural area of Thailand, the pediatrician is very limited for performing a physical examinations and treatment of our children. Therefore, healthcare officers and nurses who work in the family healthcare hospital have an important role on the in communities. For example, they provide the vaccination, treat uncomplicated disease, and perform yearly physical examination in the elementary school. Accordingly, the improvement of a congenital heart disease screening through existing healthcare service activity should enhance the possibility of the early detection. However, the most important obstacle to achieve the detection is inadequate knowledge and examination skills related to the cardiovascular disease. My study aims to implement a congenital heart disease model and assess the ability of congenital heart disease detection by healthcare officers and nurses after participation in the model. This study conducted in the Surathani Hospital, which is the southern province of Thailand, and the congenital heart disease screening model was established to provide acknowledgement about the congenital heart disease and physical examination with the aim to the rapidly detection during the routine service activities. And the pediatric cardiologist confirmed the diagnosis. 3 steps of the model were participation in the congenital heart disease screening course of healthcare officer and nurse, and then screening at the respectively elementary schools during their service activities, and re-evaluation by pediatric cardiologists of children suspected of having congenital heart disease. The healthcare officer and nurse were trained in a congenital heart disease screening course. This is the one-day congenital heart disease screening course, which composed of the lecture section and the practical section. For the lecture section, the lecture focused on the importance of early detection and the common physical examination findings. A PowerPoint was given with multiple illustrations by pediatric cardiologists. For the practical sections, the attendees were divided into 6 groups, with 1 pediatric cardiologist present on each group. The demonstration patients were rotated every 30 minutes, and the healthcare officer and nurse performed physical examination on each children. Afterwards, our children were present together to compare the disease and for further gain more examination skills. We have 7 demonstration patients. This is the different types of congenital heart disease and the congenital heart finding. For example, the child with Marfan syndrome revealed dysmorphic features, mitral valve creak, and pansexoric murmur. A girl with pathology of Fallot revealed central cyanosis, cupping of fingers, systolic ejection murmur, and the ventricular septal defect child present pansexoric murmur. For the Eisenmenger syndrome, who developed Eisenmenger syndrome from the large ventricular septal defect, revealed cyanosis, second heart sound loudness, and diastolic murmur. The ventricular septal defect and Eisenmenger syndrome patients were present together in the same group to compare the early and late stage of the disease. After training, the healthcare officer and nurse will perform screening at their respectively elementary school. During the screening process, checklists of common manifestations were provided to facilitate the accuracy screening. The children suspected of having congenital heart disease were made appointment to the pediatric cardiologist at Surat Thani Hospital. The ability of congenital heart disease and cardiac murmur detection was evaluated based on the positive predictive value. Let's see the results. A total of 153 healthcare officers and nurses were trained and screened in 23,633 children in 169 elementary schools. 312 children were suspected of having congenital heart disease, and 26 children were excluded because of 5 children were had previously diagnosis and corrective surgery, and 21 children had non-participation in the final programs. The remaining 286 children were examined by pediatric cardiologists. Okay. The chest wall deformities were found in 4 children. 2 had pectus excavatum and the other 2 had pectus carinatum. A normal physical examination found in 161 children. The pediatric cardiologist detected cardiac murmur in 121 children. Of these, 38 children had congenital heart disease and 83 children had innocent murmur. They had a normal echocardiography. Okay. Oh, sorry. For the positive predictive value of the screening, of 286 children with screening positive for congenital heart disease by healthcare officer and nurse, 38 children had congenital heart disease. The positive predictive value was 13.29%, and of 244 children with screening positive for cardiac murmur by healthcare officer and nurse, 121 patients had cardiac murmur. The positive predictive value was 49.59%. Among the congenital heart disease children, ventricular septal defect was the most common type of lesions, and all of them had small lesions and asymptomatics. The second most common type is atrial septal defects that comprised of 23.68%. 2 patients that touched arteriosclerosis patients were 7 and 11 years old girls. They had significant hemodynamic change and underwent transcatheter intervention for PDA device closure. The result is excellent. The remaining patients, for example, pulmonic valve stenosis, pulmonic valve regurgitation, aortic valve regurgitation, and mitral valve regurgitation were asymptomatic and follow up in the cardio clinic at Surat Thani Hospital. Okay. Congenital heart disease is usually detected in the newborn period by routine physical examination and when symptom appears. This, for example, cyanosis, congestive heart failure, and low cardiac output. This lesion type usually occur in the cyanotic heart disease, large ventricular septal defect, patent ductus arteriosus, and coagulation of aorta. But remaining newborns have their condition unrecognized until adulthood, at which point may be beyond their ability to correction. In the past, school children were the target group for mass screening congenital heart disease. Because of there are many people, and someone missed the diagnosis in the newborn period. And this is transitional period to detect before the late stage of the disease. For example of screening method were tape recorded heart sound and the two-level heart screening. This is the acceptable result, and the method is quite good. But as I think as an alternative method, and encouragement of medical personnel who work with school children by improving their skill to screening congenital heart disease, increase the recognized case. From this study, the ability of recognize congenital heart disease and cardiac murmur was quite low, possibly due to we exclude the 26 children with the previously diagnosis and non-precipitation from the study. And in addition, lack of previously practical section is the important factor on the result, because the ability to detection and accuracies with on the training session. Okay. The limitations of the study. We not focus on the differentiation between innocent and pathological murmurs, which is the cause of high false positive for congenital heart disease children. And short training course to gain the skill to screening process. Okay. And we could not demonstrate the specificity and sensitivity for the screening methods because of all of 23,633 children were not repeat examination by pediatric cardiologists. A future pilot should extend the screening course, training course, which emphasize on the differentiation between innocent and pathological murmur. In conclusion, healthcare officer and nurse have the potential ability to recognize congenital heart disease, and effective training course and promotion of congenital heart disease screening during the routine service activity can provide opportunities and detect congenital heart disease for optimal therapy. Thank you very much.